All right. So now that we're recording, we're good to go. So your module exams is gonna be an hour long, and uh, it'll be recap all of the chapters that we have gone over this far. Um, please note if anybody's having any issues or troubles, please let me know. You need to let me know sooner than later, so the better off we are. If you potentially have technical issues, a screenshot included in the Discord or email is really helpful and beneficial. It keeps me from having to do a lot of digging within the program because Navigate will tell me almost everything in the world I need to know. It just validates just what's going on. So as you can see tonight, we're going to talk about the lifespan development. We all really know about lifespan. We know, newborn infants to, adolescents to preteen, teen, and then to adults and geriatrics. We know those due to Joshua, to answer that. Let me back up. Bailey, do we want to test tonight, or does it just opens tonight, Bailey? And Joshua, the deadline for the module is also in 3 days. So you get 3 days for each. Just the difference in the module is going to be an hour long. So back to this. So, just as in going through normal lifespans of our own, we've dealt with all that. So that we should very much understand the difference of lifespans. I'm already over here pushing the wrong buttons. So as you know, we talk about this. I don't want to read that tonight, so I'm just gonna let y'all know. The lifespan applies into patient assessment because we need to know what lifespan of a patient that we're dealing with. Even though they may have special needs and they show signs of being an adult, we need to understand that sometimes that the mental ability may not be there, and we may have to back our treatments and our questions and all that down just a little bit. Now, please don't be dumb it down, because there's a lot of people out there that are super smart and we awesome. Oh, well, Josh, happy birthday. I saw somebody post that. I will tell you what, I'll give you an extra, not a time, sorry, just picking. No, but happy birthday to you. I hope everything goes good. If you hurry and do a good grade on your module, you'll give us 100 off doing so well. So some of the things we're talking about, human development, EMTs, be aware of the physical changes. They may affect some of your approach to your patient care, specifically when dealing with babies. So let's start here. I like dealing with babies more because they really can't tell you what's going on. You just got to figure it out. Crying babies mean things. Quiet babies mean things. So you're gonna have to figure things out. That's why it's a little bit more challenging and more fun to deal with pediatrics. So the biggest part of some of the notes that if I was writing notes that I would go over is when we go over these different ages of the lifespans, I would make notes of that because that's very beneficial. All right. So neonates are going to be from birth to 1 month old. So then they change. They don't really tell you that it's neonate versus, infants. Now they really factors that into when you go to a medical facility, let's say that specializes in pediatrics, because they will change floors on how old they are. So that's the biggest thing that you kind of consider there. So neonates birth to 1 month are covered. We're going to go more over that into chapter 33. And if some of y'all, the later in we get, well, I had said that, let me don't. So Navigate in the book don't correlate with the correct chapter numbers. So that being said, I've changed some of the chapters later than we go throughout this, but I didn't change all of them because I got tired of doing it because there's so many chapters. So if we're going to do later down the road and it says chapter 33 and you pull it up and something says chapter 34, just roll with it. I promise you I have correlated them correctly, but just know that I just got tired of trying to fix it. So that's really it. So infants, and again, that is from 1 month to a year, and they start to developing. They develop pretty fast. I mean, it is pretty rapid on how fast they grow. So then we move over into their weights. Their weights are also important because we need to know. I was trying to catch that. Rose, what's I was seeing the 9 got me. So, so the weights we measure those in kilograms, and just so everybody understands, I'm not by knocking nobody. To convert pounds to kilograms, that's you divide it by 2.2. So if you're 200 pounds, that's basically 100 kilograms. You just cut it in half. Now I know it's technical, and you got to get the 3.5 kegs if they're 8 pounds, because that is correct. But that's how they do it. So neonates, as you see there, that normally weigh 6 to 8 pounds. Now a lot of the babies are not in that range. They may be cute infants once they're born due to their weight, but time-wise of their health, they may be just considered neonates, but dabble in the infant stage because of their weight as they come out. So as we go through this and we go through burns and we talk about burns later down the road, this plays in a particular fact too, is the head accounts for 25% of his body weight. So they're top heavy. That's why they have to take so long to learn how to sit up, because them big old melons they got to figure out how to use them. They're not real sure on what to do with them because they just so heavy. And when they were in the mother, they were in that amniotic fluid, and it didn't weigh nothing. So we had all of that. So that's unfortunately when if you drop a baby, they're gonna go head first because of their head's heavier than the rest of the body. It says after 2 weeks, infants grow at a rate of about 1 ounce or 30 grams per day, doubling their weight by 4 to 6 months and tripling it by the end of the first year. So they grow in weight. I mean, you take these babies from mother's milk, or you put them on a milk, a formula, and then if you add rice to it, so those are all those things. That's why they get so chunky. I mean, that they grow pretty quick. They absorb those nutrients, and it turns it into just loveness. I'm telling you, they're so fluffy. Why did that not go? Here we go. All right, so in the cardiovascular system, at birth, the neonates makes a transition from the fetal to independent circulation. So what that's telling you is, if you have the umbilical cord. So yeah, their heart's beating, it's pumping and all that, but a lot of the blood comes from the mother, that is filtered and non-filtered. So the mother is cleaning their blood just as well. So the babies their heart are beating and their lungs are moving, but remember this with the fluid, so they get all their they excrete all the fluids and everything differently than way we do. So their pulmonary system, and it's prior to birth, the neonatal's lungs have never been inflated. So they have the ability to flex in the womb, but they don't ever have air in them. So the first breath is facilitated, and part of the chest passes through the birth canal. It increases in intracranial pressure. So they're like, what is all this? And that's the first thing they do, is they gasp. That's the reason why we have to be very careful when we deliver babies. And just so y'all know, so we can pass this on, that is a basic skill. It's not a paramedic skill to deliver a baby. So I just want y'all to be okay. So if your medic goes, saddle up, cowgirl, it's your turn to get this baby delivered. It's a basic skill. So infants younger than 6 months are particularly prone to nasal congestions because why? Can anybody tell me that? Why are they, prone to having nasal congestions? Everybody's quiet tonight. Y'all all shy. Come on. All right, we're going to go over that some more later in the respiratory section, but I was just going to see. So infants have proportionally larger tongues and proportionally shorter, narrow airways. So airway obstruction is more commonly in infants. That's why they get choked up so much, is because it's like, you can basically say is they don't know how to work everything. They're trying to figure it out. What's going on? What's all this? What's this tongue do? How does that go? Rebecca, because they have been in amniotic fluid for 9 months and they have exposed to the air of the open. Correct. So they've been protected in this cocoon for so long that that nothing was there. So they're more likely to get exposed to all this in the air, and they're like, their bodies are like, we don't know what this is, so they get sick a lot. And when you put them in daycare, they get exposed to all these different things, which is normal. It is what it is. So when you look at their airways and their tongues and you understand how the anatomy of that is, you get why they get coughed and they gasp and they don't know how to function with the tongue and eat and drink out of a bottle and or just eat properly, so they get choked up. So a lot of times when parents are like, oh, they gasped, they quit breathing. Correct, because of they didn't know what to do and their body just hit the reset button. Sometimes the babies do choke, gasp, and do quit breathing because it's a respiratory distress mode. Their bodies don't know how to function. So the rib cage is less rigid and ribs sit horizontal because there's not the muscle bands are not used. They're not strong yet. They're not set. The ribs are function. They're there. They're tiny, but they have a lot of give to them. So that's the reason why when they're all bundled up, their ribs could flex. I'm not saying they're going to come out anything out of proportion and out of their normal state, but they able to give. The cartilage in there is not normal. So if you have to bag valve mask an infant, remember that the infant's lungs are very fragile. You have to choose the correct bag. And if you don't know what a bag valve mask is, we'll definitely go over that later. But you make sure that you choose the correct one. They have infants, children's, and adults. Now, yes, that's like, oh, well, that's only 3. Well, that covers a vast majority of the people. I've actually used a child ambu bag on a grown adult, but she was such a small lady, the quantity, and it just met the need of it. When I intubated her and got her situated, I had great movement and my tidal volume was there, so I stuck with it. So we'll show you those bags as we hit into the respiratory section. And just to let y'all know, that is a large section. Just gonna tell you. And that was not, I think that's in the next module that we start to talk about. Also, respiratory muscles are immature and there are fewer alveoli in the lungs. So they breathe super fast. So their respiratory rate is going to be increased, and they can go hypoxemia, they can go hypoxic a lot faster than normal because the lack of the alveoli, and there's not enough to hold the oxygen cells in there. So any respiratory problem in an infant becomes more life-threatening because of that situation. There's not enough there. If they get so many alveoli blocked, they get into distress. So that's where the concern comes. That's the reason why you aggressively treat infants and pediatrics when it comes to respiratory situations, because you need to stay on top of it, because you can't wait. You have to be aggressive in the medicine on the younger ones versus, oh, let's sit back and see if this medicine waits like they do for us. Is because we need medicines to last, in our body, up to 72 hours to start with, and then let's move. Well, you have to be very cautious on that. So we talk about the nervous system. It continues to grow more and more even after birth because things are developing. Sensory muscles are growing. I mean, the sensories are there. They had these synapses, but they didn't know how to function. They didn't know what it was. So the growth and the movement of the body and all that makes this nervous system continue to grow. A neonate is born with certain flexes, but moral flexes, like their startle reflex. When a neonate is caught off guard, it opens his arms wide, and it's like, how they spread their fingers super wide and and they open their arms because they don't know, and it looks like they're trying to grab things because that's how their body teaches them to be startled. They don't really know. They're learning all that. Let's see what yours say. The palmar grasp occurs when an object is placed in the neonate's palm. The rooting reflex, neonate instinctively turns the head when something touches his cheek because they know to go towards it. Like if a mother rubbed their belly when they were babies, you could feel them poke out, and then they would do that. Sucking reflexes occurs when the neonate's lips are stroked because they've learned that's how they eat. So if you were to let them suck on your pinky, that's what they know. It's like an animal. When you have a new puppy or something, they'll suck on your finger because they've learned that's how I eat. If something touches my lips, I know that if I, bite it or suck on it, it produces nutrients, and that's what they want. All right, let's see. The fontanelles. So we talk about the fontanelle spaces and how they grow and the gaps between them. Most of the time they're going to start, fusing by 3 months. We're going to show you in the next picture what it talks about, shows, and where it's at if you're not familiar. A depressed fontanelle may indicate major dehydration. So that's important. So if the question would say, what does a depressed fontanelle indicate? Well, it indicates dehydration. And then a bulging one indicates increased intracranial pressure. I'm gonna do that a couple of times. I'm gonna let y'all know that's important. A depressed one indicates dehydration. A bulging fontanelle is indicative of an increased intracranial pressure. So it could be from trauma or birth issues. So those are very, very important. I don't know if you want me to pause so y'all keep writing that, but let me know. All right, so look right here on your picture. So y'all can see my mouse moving around. So this right here is the places I'm telling. This is what you're gonna feel. When you see the doctors always grab the babies and they rub them, and this is what they're trying to feel. Is it depressed or is it bulging? And they want to know how big of the gap it is depending on how well the babies are growing and the skull is aging with the child. If there's a gap, if there's a gap here longer than it should, the doctor's going to want to go for an MRI. You can feel this one back here, but it's not nearly as big. And then if you look on the side, right around the temple area, you'll notice another one. These are the ones, the anterior fontanelle that's on the top of the head right here is what we want to check when we get a child. You go to a car wreck and the parent allows you to hold the baby. You want to hold them and act like you're rubbing their head with a flat hand, but you be very careful because you don't want to press in that area, because if you see through this picture right here that there is a gap, yes, it is hard to, but if enough pressure is placed there, you can actually depress into the skull. So I like to hold the babies when we go to Rex, and we just learn that. I don't have the slides in JB Learning for this chapter. Rebecca, I'll have to look. I'm not real sure. I haven't. I was in there earlier. We've had some, as y'all can imagine, some issues with JB Learning. It's more on the technical side of things versus any valve problem. So I will check into that for you. I had them last night down. Let me dig into that. I'll check and see what's up when we get done with this or on a break. All right. So let's see. Y'all's information is more important. So at 2 months of age, tracking an object with their eyes and recognize familiar faces. So they know when you walk, they may not have the distance or 20/20, but they know the familiar face. They know the sounds that correlate with that voice, that face of what's going on. So at 6 months of age, they should be starting to sit upright, maybe start babbling. They have those. That should be their progression state. At 12 months of age or sooner, they can start walking with minimal assistance. Now they're going to do all that scarecrow walk, like wobble, bounce, and fall. And some may start walking, 8 to 9 months. It's the overachievers. Let's see. So the immune system maintains some of the mother's immunities. That's why they always increase. If possible, allow a child to use mother's milk as long as possible because of the nutrients it's passed on. Some of the just it improves their immunity so much better than what can be produced by a factory. So that's why they like for that to happen. Infants can also receive antibodies via breastfeeding. That's where I was going, and boosting their immune system. So we'll just maybe I should know what's on the screen. Ha. All right. So if you look here, this should be in your book also on 7-2. Uh, Beginning at birth and develops as the infant interacts with and reacts to the environment. So here's some of the things broken down into months on what they should see and how they can do. Give me just a second. I'm gonna mute y'all and uh, try to mute y'all, and then 2 seconds. All right. So you should be able to see this. It's not like that's something that you're mandatory to know, but you, if you've never had a child or one that's close to the family, this will give you an idea of their progression in age. So if you go to take care of a kid and you're like, wow, at 6 months old, they're like just a blob in the bed. Something's wrong. What kind of medical history does your baby have, ma'am? And then maybe you can pick up some information from there. Um, so we got some sick babies across this country, and then some that live next door to us, and you never know about. So if you ever have to go pick them up on an ambulance, and you may just have to ask questions because you're not familiar with that. Some of the psychological changes. Crying is their only way of communicate. They can't be like, "Hey, bro, my diaper's wet. I need you to change my butt." It just don't happen. So the only thing they know to do is to cry because their vocabulary and their brain has not grown far enough further to do this. So what do? They just cry. That's why some babies are just unhappy because they may have reflux or inner ear issues, and all they do is cry. So some parents do get pushed to a limit, and they just like, I don't know what to do. Unfortunately, that's where some of the babies start to have safe and baby syndrome, or they get they're just like, I don't know what to do, and they just throw the baby. That's not what we want to happen, but that does happen, unfortunately. So that's where this stage comes because new young parents don't know what to do. So it's where they end up, unfortunately. Um, so bonding is, it's, we know this just like us. We bond with animals, certain things the longer that we're with them, and those are our security blankets. So the more that they're with them, they should bond to somebody. But if you see a baby that is withdrawn and don't want to be held, or they reach out to complete strangers because they're looking for that. And anxious and avoidant attachments is found in the infants who are repeatedly rejected. So they don't really. It's just you can pick up on the body and the children's demeanor. What's wrong with this baby? Why is this? What's going on? Children slow little emotional response to their parents or caregivers and treat them as they would strangers. Because they're shunned, or they're abused as babies, and they're always they don't know what to do as babies, and they cry. Well, maybe some things are happening to this child, and the babies just unfortunately learn at such a young age that they just keep quiet. Separation anxiety is common in older infants because that's why we drop them off at daycare, and they start to have these issues. They cry, they moan, I don't want to, they have all these until they reach out and realize, hey, look, it's pretty fun here. I don't need to cry anymore. Trust and mistrust. Trust and mistrust refers to stage of development from birth to 18 months, which involves an infant's needs being met by his or her parents or caregivers. So they only know the closest ones to them. And if their closest ones to them aren't providing that, they don't know what to do. They do have trust issues. It's like us. We get old and we're like, you know what? I'm not going to touch that again because that burned me. I don't trust that no more. Somebody try to get you to hold it. Be like, nope, I don't trust you. And it's not like you mistrust that person, but that's over time, your life is issues have shown you're like, you know what, that's a tie, I shouldn't do that. And then somebody touches it, tries to give it to you, and just out of repetitiveness, there we are. So that's what we learn too as growing old. Mhm. All right, toddlers and preschoolers. So we start to increase activity. We start to see where their heart starts growing. We talked right there, the cardiovascular system of a toddler, 1 to 3 years, or preschooler, 4 to 6, is not dramatically different from an adult. It besides beating faster, it does beat a little bit faster because they require that much. As an age goes, they may slow down, and but they start to develop the same rhythms, the same heart rhythms, the same heart patterns. They can have AFib, they can have tachycardia, but it could be because of something else. Could be some other drive is causing that cardiac rhythm or an infection. Let's see here. So preschoolers, we're going to talk about this. Pretty good to know this one. Preschoolers are 3 to 6 years of age. Their pulse rates mainly are from 80 to 140 beats per minute. They breathe at a rate of 20 to 25 breaths per minute. And their systolic blood pressure is 80 to 100 millimeters of mercury. I remember the mmHg. We talked about that the other night. Things are measured in millimeters of mercury. So I'm gonna pause that for a second, let y'all get some notes off of there for the preschoolers. All right, so toddlers and preschoolers don't have a well-developed lung just yet, and they're unable to sustain deep or rapid respirations for an extended period of time. They just know that what we say right here, that they breathe, let's see, they breathe from 20 to 25 times a minute. So that is about it. That's about as fast as they're gonna go and as rapid as they're gonna go. All right. Sorry if y'all heard that. My daughter fussing. And the weight gain should start to level off. You may have your chunky babies, and they're starting to get more active, and they're starting to get more playful. So their weight may start to shed. They're not going to gain weight as fast as what we've seen. And the loss of passive immunity is one of the most impactful psychological change at this stage. What's it say? Neuromuscular growth also makes considerably progress at this stage. And then toilet training is usually completed around 28 months of age. If they stubborn, they gonna be like that. There you go, Josh. Some kids may learn to potty train sooner, and some of them are just like, you know what? I'm gonna do it on my time, not your time, my time. As much as we try, that's just gonna be what it is. Josh, did you get that EP written down?
I did, thanks.
All right, cool. I just didn't want to go far off without you. All right, so some of the psychological changes here. They're gonna start learning. Let's just say 36 months of age, basic language is mastered. I don't know about that. I think sometimes they say some of the wildest things, and you're like, whoa, whoa. Sorry, Joshua. I apologize. Joseph, Joshua, y'all. Hey, we're gonna have to. We gotta get that situated. I'm gonna call y'all the wrong names for this entire class.
No worries, brother.
Let's see. The psychological change for this age group is sometimes referred to as autonomy versus shame and doubt. By the age of by 18 to 24 months, cause and effects begin to become understood. Interaction and playing games with other children begin. Joshua, that was a good one. I'm gonna get you that one as long as I pass. I give you. So they know they pick up these things from what is that? See monkey do, do as monkey sees. So they all learn these things. They see a kid throwing rocks. That looks fun. So what do they want to do? They're gonna throw rocks. Now it's not the right thing to do. Then they get home and throw a rock at the window. Well, the kid that showed them that didn't throw a rock at the window. But they see, yeah, monkey see, monkey do. Sorry, see, I'm telling y'all gonna keep me straight. So this is their learning phase, and their influences that they come across is what is going to teach them until parents, we as parents, you as parents, can show them, a less of path. So we want to make sure you teach them right at the young age so they can learn these things and move forward. And children learn to recognize gender differences by observing role models. Um, it just depends on what's being taught to them also. Um, school age children. So physical changes from the age of 6 to 12, a school age child physical traits and functions continue to mature at a rapid rate. We'll let that one sit for a minute just in case y'all need anything else. So the school age that we're changing. So we went from toddlers and preschool to school age children. If y'all need to know the difference, what the age group is, because y'all may see that later. All right, let's see what's up next. All right, so what they're saying is they're going to grow about 2 to 4 pounds and 2.5 inches each year. Permanent teeth start to come in. Brain activity increases in both hemispheres. Well, I think mine was a little late in life, but that's me personally. So this is the gauge where obviously in school age, we're going to start showing them things, repetition, teaching, some, multi-brain function skills, as in math, reading, science, things like that. That's going to require them to think harder, master the ability of, like I said, repetition. You start to have the children learns different types of reasoning, pre-conventional reasoning versus where children act almost purely to avoid punishment and get away what they want. We all know that. I think spouses do the same thing. Male, female, we all be like, I don't know. And then the kids look for their approval by peers and society. Is this what y'all want? Am I doing it right? So I always resort to my kid playing baseball. Anytime he'd get on base, he would always look back at me, and he wants that encouragement. Did I do the right thing? Is that? And then by his reactions by your reactions, I'm sorry, would set his mood to go towards the next time. Did he do something right, or did he not, make a wrong swing? So they want your approval. The same thing in school. They want to be liked. They don't want to be picked on, but society sucks and everybody gets picked on these days. So I pick on my kids pretty hard, and whenever they're at school, they're like, you're nothing compared to my dad. So I'm that guy. So post-conventional reasoning, children make decisions guided by their consciousness. And they're learning what that is, children begin to develop their self-concept and self-esteem. Oh my God. Yeah, my baby, she's my youngest one. She's going through that right now. And oh Lord, I thought I had a baby girl first. I'm not sure that I had another one. But here we are. So they're learning these things. They see social medias out there. They pick up what is approved, what is not approved, what do people say. Their friends do this, or I don't wear the right clothes because my friends wear this. So we've all been through there in our ages, in our times, but I can say this as a parent, that it's learning those things when you see them, it hurts more than I guess as you going through it as a kid, because we know that, like, baby, this is just a time phase, that it will grow older. But then it kind of upsets you as a parent because you're like, oh, those parents should be teaching them, but they're at that age, they're in that school age division. Now we move into a harder one. Whew. Adolescents and teenagers. It is difficult when your 6-year-old tells you she can't wear blue jeans because they make her look like a boy. Oh, Armand says, I got too much hair on my leg. And I'm like, baby, you're 8. That's it. I don't know what to tell you to do. I agree, Becca. It's just the case. So at 12 to 18, we start to see these physical changes. And So vital signs begin to level off with the adult range. So theirs is going to be the 12 to 18s are going to be about what they should be as a baseline as an adult. Their pulse rate's going to go to about 60 to 100. You notice it's starting to slow down. Respiratory rate is 12 to 20, slowing down, and that's what it's going to stay unless there's an issue. Systolic blood pressure should be 90 and 110. It depends, you may, the perfect blood pressure is 110 over 70, and that's textbook. But again, I mean, you got to look at what's going on. What is this kid worked up over? Is something bothering them? Or are they at that age that something's on them? But they have a medical issue. It could be just as that too. So I'm gonna let y'all pick that up right there. If y'all need anything else, let me know. I'll go back. So adolescents experience about 2 to 3 growth spurts a year. That's just where you go through buying all these clothes. And you're like, oh my God, but you just like, you're wearing my clothes now. So my 18-year-old, or 17-year-old, he goes in my closet, Dad, I'm borrowing your boots. Well, bro, no, those are ostriches, not like work boots. Come on now. So you get ready. Girls generally finish their growth spurts by 16 and boys by 18. We know girls are more mature than boys. I'll say it myself, 100% true. And I think this is why, because they hit their growth spurt earlier and they start to recognize things. The endocrine and reproductive system matures and the secondary sexual development takes place. And this is happening earlier at my house. Pubic hair and auxiliary hair begins to appear. Voices start to change. Menstruation begins. And see, I think in this age group that's sooner. I know, baby, that's just what this says, but I think they're wrong. So they're wrong. So when you look at this, understand that now when you deal with these age groups, so if you sit at this age group and you dealing with a 13, let's say a 13-year-old kid, and you're like, bruh, his voice is deeper than mine. Well, like he got chest hair poking out the top. Holy cow. You don't treat him as a 13-year-old because that's what they say, he's in an adolescent teenager division, but you're going to treat him more as a grown adult. Does that make sense that y'all are kind of, Rob's saying, eat food like I do. You'll see Rob's always in here with these wonderful noises. He's giving us the Rob wisdom. But know when we do these things that we're going to take care of this kid. You're like, so what should his blood pressures be? Well, now if you'll look, this kid that's 13 with these full body hairs and all that should not. What's it say right here? The boys stop at 18. I have always blamed it on the chicken, girls and boys both. They've grown more, developed more because of what's being processed, and our foods are changing, and just the environments. That's reason why. Rebecca, I've said it till I'm blue in the face, but so let's look at the genders of Tom. So look about what our parents, so my dad's 65, 66. I'm 40. Nobody joke about that. Let's not pick on me here. So if you back up what he saw at my age versus what I've done, we have more development. So I've seen, unfortunately, more than maybe he did in his time, but that's due to development of society. So I look at it as these young babies, let's go back to here. These babies, the school age at, what did it go? Right here, 6 to 12, they start going to developing what a teenager should see because of developmental changes. It's going to affect their body growth. You may start to see breast buds sooner. You may start to hear them complaining of menstrual cycles a little bit earlier because of what's being done in society. And it's not trying to say, oh, the news. No, screw that. I'm talking about the food. What is being put out there? What are they putting in their bodies? What medications? Just you think about those things, and that's the reason why I say, yes, look at this right here that I'm circling on the screen, but treat your patient for what you see. There's a statement said in the paramedic world is don't treat your monitor, treat your patient. So the same thing here. So Bailey says over 35 and obese considered geriatric. Hey, whoa. Why are you talking bad? I control your grades. Whew. Fine. I'm just going to know where that comes. Now I'm picking. So, you got my. I forgot where I was at right now. Whew. Next, I'm gonna have to change screens. Literally blew my mind. I forgot what I was talking about. Senior moment. You're right, Rob. So look at this slide. So when we talk about psychological changes, we talk about smoking, illicit drugs, unprotected sex, eating disorders. We deal with that now at school age. Just because they say they're adolescent and teenagers doesn't mean that they're only going to see that. Look about the cigarettes if parents smoke, or the accessibility to vapes. What are vapes doing? Currently, a family friend of mine, I think she's 19. Yeah. She just graduated last year, or maybe this year. I don't know. But she's 19, and she's a little large, but she's developed lung clots in her both lungs and her right leg completely, and nobody knows why. Now, do we blame that on birth control? Do we blame that on smoking and vaping? Because they both can cause that, but society in there has produced those things as that's what's cool. Is it really cool for this age group to do that, or is it detrimental? Well, we don't know, but we have to treat those things. You may actually come across somebody that's in their early 20s that has COPD, or a lung failure. They may have had a lung transplant because of they started smoking at such a young age. And you're like, what? Wait a minute, what? Well, my grandmother used to smoke unfiltered cigarettes for like 40 years. Well, that was then. What's in a cigarette now? So we say those things again is to tell you that be on the lookout for these. Uh, this slide is probably one of the truest ones that I come across is because of this. They're at that age of high risk of suicide and depression, and I blame it on. Stand by. Let me go back to the right side. I blame it on to this. The sexual development takes place. That is when they all become interested in wanting to know because it's all over TV, but they are at a higher risk. And if you do come across somebody that is at a higher risk of suicide or depression, being your bedside manners and the way that you talk to them, or they won't talk to you one on one, they may not talk to you in a group setting, but once you get them to the back of your ambulance, be like, hey, listen, I noticed your demeanor's changed. I don't know you. I can't draw an opinion about you, but what's going on? The more you tell me, the more I can help. And that may be the way that you pass on information. Or if they are sexually active, just be like, is there any chance that you could be pregnant? Because I wasn't going to ask that in front of your parents because I know I could have seen where that went. But I just need to know so I can potentially pass it on to if you are, let's not say that in front of your mother, your father, whomever is allowed to be at the hospital. So just the way that you treat your patients at this age is super, super important, because the way that we're going to treat our infants versus by the time we get to the adolescents, it's going to be big time different. You can treat your infants from the feet up because that's how you gain their trust and they're used to you then, versus the teenagers, you got to talk to them from a distance and allow them to open up before you can come into their circle. That makes sense. I kind of I do that as a way that I take care of people here. Like I'll speak to them across the room, be like, "What's up, bro? Hey man, I'm Wally with the ambulance. Tell me what's going on." And then I slowly come to them. I don't just rush them and be like, "Hey, I need you to tell me what's going on right now because it's going to determine everything." Bro, you gotta get that trust built. All right, so see, I'm early adults until right now. Maybe for my birthday, I won't be in this age group anymore. No comments. All right, so early adults, they range from 19 to 40. Their physical signs is everything on them hurts. Their bones hurt. Their butt. No, I'm just kidding. So their vital signs don't really see any change. They're about the same versus what we saw in the teenage life. Um, Pulse rate, they might stay in that range. You may see an average around like 70 to 100. Maybe it depends if they're on a certain type of cardiac medication. They may be just a tad bit lower. Their respiratory, not going to change. 12 to 20 is what you're going to see with. And the systolic of blood pressure is going to be about the same too. So there's not really much we can talk about there. Um, some of their lifelong habits are more solidified in this position here. They're more hard-headed and don't want to change. It's easier to say. The body's working at a peak efficiency. See, it's what I say all the time, but my bones tell me different. But their later years of early adulthood do affect their aging gradually and becomes more evident. That's where your gray hair comes from that men show and women cover up. So my wife looks at me like she knew what I was talking about. So their psychological changes, their circles are smaller. They're just life lessons have taught them. They keep it smaller. Their family, the stress may be there depending upon what their jobs may be. Um, no, not me. I'm covered in gray, Joseph. Thank you very much. Not really, but it's getting there. Um, it is. You got to continually to put paint on there. It'll fade. All right. So during the period of adults do strive to create a place for themselves in the world. We want to cut out our own little areas. We want to make our nest. I'm not saying to be a nest forever, but we want things to settle down. We want to come home and just be like, this is mine. I'm here. Um, and despite the amount of stress and change, this is one of the most stable periods of their life, is what they say from the 19 to 25 years age. That is kind of stable for them. They may have just got out of college and they're trying to figure things out. And now that they're independent, they're on their own, they do feel more stable than where they get older, because then you're gonna get married, then you're gonna have kids. So you break that time to where they feel like, oh, okay, I got this, and all of a sudden it's like, bam, welcome to the real life, because you're in debt. I'm speaking. That's all the time. So middle adults, you got 41 to 60. You'll notice their vital signs there don't really change since the 16 to 18 group. So let's see. We can say here, this is the third spout is a little important. Menopause occurs in the late 40s, early 50s. Cancer incidence do increase in this age group. Diabetes, hypertension, and weight problems are common in the 40 to 60. Exercise and healthy diet do diminish. They do that because people are like, you know what? I got more important stuff to worry about. And they don't really put as much emphasis on going to the gym or their tans or their just their outlook. Everybody wants to be healthy, but it does take a lot to do that. So they've kind of simplified some things there in their life. A few more minutes. I promise you I'll leave you alone. You have to take a break. Some of the psychological changes here, their finances become more aware of some issues. They want to be set for life, because this is where you start to realize, do I retire? When do I retire? And how do I retire? Or what is retirement? If you're trying to figure out what is retirement at this age group, you're behind the 8 ball, I promise you. Middle adults find themselves to carry the children leaving for college, and caring for their aging parents in this age group. I'll say my dad's 65. He's caring for himself pretty well. My mother passed 2 years ago, so that's still a struggle trying to figure that out. But pretty much my dad handles his own. There's a lot that we have to do, but again, he's kind of past his age group, so he's learning. Things have become more round to him. So that's that age group. Let's see, older adults, 61 and older. Their life expectancy does consistently change. They do know that. Determined in part by birth year and country of residence. Some people live longer, depends on where they live in the world. They may be of Asian descent, may may live a lot longer than we do in the US. They often are able to come numerous medical conditions, but they need multiple medications to do this. Um, they may be on like a CVS daily regimen of medicine to function in life. That's okay. But what gets me is I always like to say, well, how many different doctors write these medications? Well, if that's the case, how many do these doctors know that you're on all this medication? So keep that in common. So if you go to take care of somebody at the same time and they hand you like a croaker stack full of medication, just be that guy or gal that says, hey, let's sit down and look at your medicine. What contraindications do they have that may function? Now, you may be able to do that into the hospital on the way to the hospital, but that's just as important. Sorry, checking out a message. So the cardiovascular system does start to decline some. It's tired. It's like a set of tires. They can't be replaced, but they do start to wear out. Um, their heart rate and their cardiac output does decrease. We do know that. Things just slow down. The heart must work harder to overcome vascular resistance, and that may be due to plaque or a medical issue to where their body is just tired. And again, it's just like, you know what, we're gonna put this in like third gear versus overdrive. So their body's just like, okay, I'm gonna hang in, but we're gonna need some extra energy to, they may need that a regimen of medications for that. And then the last one right here says ability to produce replacement blood cells declines as does the blood volume. Well, so that's important because of infections or the way that they heal. They may not be able to clot as well. You know, things like that is where you start to see this in this age group. That is some functionality issues that they deal with as the older they get. You know, I hate to say that, but we all just let's see, just we all just slow down. That's the easiest way I can keep putting it. So the respiratory system, sorry, it's the size of the airway increases and the surface area of the alveoli do decrease because of use. The usage things over time block it. They may have damage. They may not, they're start to like an infant. They don't have as much alveoli, or they're just, the alveoli don't reproduce. So at the same time as they are what they are. If they've used them due to sickness of life and over time that they just mess up and the body ain't getting it no more. The natural elasticity and the strength of the intercostal muscles and the diaphragm decrease. So you may notice that their breathing may be more labored, more of a workforce for them to breathe versus just the normal functionality as you yourself and I do. Yeah. So they don't breathe as fast. They slow down some. They just relax, and it's a labored force of breathing. It's not like it's difficulty breathing or anything like that. And at this age, they are going to have trouble breathing due to just life, but that's just part of it. And like the last one, like I just said, breathing becomes more labor intensive. Let's see what I can get out of here in the next couple minutes before we take a break. By the age of 75 years, the vital capacity may amount only to 50% of the vital capacity of a young adult. Sucks. I can say we all know going to that age that things just they're out. The older adults are at greater risk of aspiration and airway obstruction because the same thing as a child. The functionality of it is just their muscle resistance is not there. Their forgot what I was going to say because I was on track for a minute. So they do produce inspiratory wheezing. Some of their lower flow rates and air trapped in the alveoli that just doesn't close, it doesn't constrict, it just stays inflated. Older adults are more susceptible to lung infections, as we all know. That all happens a lot in life. So those are just unfortunate part of the older, progression as geriatrics as we get. Their endocrine system, we know the insulin does drop off. That's where sometimes your older diabetics come into play here. But at the same time as it may be an untreated diabetic or an unknown that they've had for so long. The reproductive system changes to some extent. Hormone production for both sexes gradually decreases as they age, and the sexual desire may diminish with age but does not cease. So they may still want it, but they ain't gotta have it. So there's several things here. Their hormones decrease, they lose their estrogen and their testosterone rate, and they just feel cool and I don't wanna, and just they decrease in their levels. Um, Obviously, we know their digestion decreases. So the taste sensations, I don't know if y'all know this, but your taste buds change every 7 years. You can imagine some of the things like they were like, oh man, this is really good, try it. And they're like, I don't really taste anything. Now you say the taste now, and everybody freaks out because they're like, oh, you've got COVID. No, they're 85 years old. That's part of life. Some things just don't taste the way they do. They Tooth loss makes chewing difficulty. They may have their full set of teeth, they may have dentures, they may have implants. They have these, the implants have come a long ways from what I remember. Is nobody had implants, everybody had dentures. So implants are kind of the new thing versus dentures. Let's see what it says there. Saliva secretion decreases, so they're constantly like, or they always have water in their hand or shaking that glass of tea. That's just part because their mouths are dry. The ability of intestines to contract and move food diminished. So the way that I look at this is, that you may poop 2, 3 times a week, or some people may not, but once a week. But elderly adults may not do it once every 2 weeks because their body just doesn't move as rapidly as ours do. Gastric acid secretions decrease, so that's going to have issues when processing a food. As you see on yours, gallstones become increasingly common. Yeah, that just sucks. And the decrease of velocity of the anal sphincter causes fecal incontinence, so they do get impacted a lot. Sometimes they got to get that fixed. They may be on a stool softener all the time, or they may not just be, and that sneeze is a poop. Unfortunately, because that sphincter is just, he's woe out, bro. You got 65, 70 years of life of, sneezing, and sometimes you just, whew, that's it, boys. So I'm gonna give y'all a few minutes of break. I'm gonna get something to drink and take a break and scarf some food down. Rob says, hey, all right, I'm gonna give y'all 10 minutes and I will see y'all in a few. All right, see y'all in a minute. 10 minutes. See y'all back at 7:12. All right, guys, I just want to make sure I go over a few things to kind of sit this back at home. So we've noticed over the past some things have changed and registry's kind of leaning towards a few things that we want to make sure y'all pay attention on the psychological differences and the priorities along with the minor change of the vital signs because National Registry has seen a lot of those here lately. You may see the BP drop, the BP rises and it's all tied to weight. So you may see some of those changes and you may want to resort back to some of that information. On registry, we've noticed those changes. Remember in the priorities, they change a lot due to age groups. Their focuses, when we talked about the 41 group and they talk about, they settled down, or sorry, the 40 and under group, they go more towards, they're settled down, their peace, their nesting, their blood pressures. You'll notice if you'll go back and look, there's about a 10-point difference on a couple of the psychological changes of the blood pressures. So pay attention to those direct changes. I'm chatting with Rob too. He's going to talk a little bit further in some detail on that as we maybe take a break in a minute. Where are we at? Oh, look at there. So the renal functions of this age group. So we know that the filtration process slows down. That declines from about 50% of the group versus of what they did at 20 versus their functionality and their function rate. So that's where your kidney stones start to happen, gallbladder stones, and just they may have UTIs, the urinary tract infections. The kidney mass, what's that say? The kidney mass decreases by 20%. There is very little blood supply to the kidneys. There isn't the blood supply to the kidneys. There is a decreased ability to remove waste and to conserve fluids when we need. So we notice those changes again because blood vessels are getting smaller. Blood vessels start to they do rupture a little bit. You notice in your group, you tend to bruise easy. You have bleeding underneath the skin. They may just a slip, trip, and fall from a regular 18-year-old kid versus a slip, trip, and fall from a 80-year-old can be life-threatening because of the age, due to their inability to clot. They may have broken hips. They could have infection can start in because of their blood cell counts are lower. So again, just because they have a simple trip and a fall and they're awake, alert, and oriented to everything around them, you need to dig a little bit farther. Check for those pedal pulses that are down on their feet. Check for range of motion because if they're aged, they may have more damage to the insides. Why? Just sometimes that works and it doesn't. So, all right. So their nervousness system, their brain is going to shrink 10 to 20% by the age of 80. That's the reason why I'm full of useless knowledge. So maybe by the time I get to that age, I'll just know important stuff. We know their motor and sensory become slower. Their reaction times are slower. When they drive, we mainly rely that onto their driving abilities and their, let's say, because your grandparents, your parents may have a little disability on their speeds. They may react times are a little different. The neurons become lost. I read a thing about 3-4 months ago that by the age of 55 or 60, you lose 50% of your neurons. That is crazy. If you think about that, man, you lose a lot of your knowledge. And it's like, you know what? Like, it just goes in time and you don't even pay attention. Some of the skill that you have you decrease. Let's say you may have been a great pool player, but by the time that you're in your 70s and 80s, you don't have that skill anymore. Yes, I know you don't use it, you lose it, but again, that's all different. Their sleep patterns drastically change. That could be due to narcolepsy and age. Um, just their body just slows down. They get tired. They may take several naps a day. I'm trying to tell my wife that that's okay for me to do that, to take naps. My wife could literally sleep 36 hours in a row, but that's a different story. And she's not in her 80s, I can promise you. But the so when you treat these patients and you get to these age groups, understanding some of the life cycles and their priorities are going to allow you to do your treatment different. Um, and if you go to somebody that's in their 70s and they got more energy than what you got as a 30-year-old, EMT paramedic on an ambulance, I need to know what they're doing. You need to send me some secrets on what this person's doing because daddy is struggling on a daily basis. So help a brother out. All right. So now we look at their some cut downs and some pictures of their brains. Look at these spaces. If you'll notice in the very top one, that is a young adult. So you don't see much gray matter in there. You see that it's full, it's thick. You talk about the subdural space is very minor on the younger adult. Then you go to the older adult and you notice that the subdural space is bigger. We talked about that a second ago that yes, you're correct on that. Eating right is also very important. So eating correctly, the proper times, your calorie intakes is very, very important. Um, so we know that the brain does shrink and it shrinks from the outest to the most inner layers. So I like to break it down a little bit more on this one. So look at the gaps between the meninges right here, that this could be a subdural hematoma that has just gone unknown. The brain has shrunk drastically in this too. Look at there. You'll notice, see how the space right here where the spinal cord comes down, you'll notice there's a lack of space right here. So that may also describe some of their loss of function. They may have um, a hematoma in the area because it's just grown that way over years. And it's just because it's taken up the space that the brain has shrunk and nobody has noticed because there's really no reason to get an MRI and to see if there's all the blood that's up there versus the pleural space that's needed. So it may be your time if you're doing a right assessment that you catch those things. So again, doing the correct assessment for the proper age will help show these signs and symptoms. Could show these signs and symptoms. I want to clarify that they could. So we talked about the pleural peripheral nerves will slow down at age. Sensations become diminished and they may be misinterpreted because they're like, oh, I don't know, why did I do that? So the increased reaction times cause longer delays between stimulation and motion. I refer that back to driving, gives you a better idea of the reaction times versus recognizing something's happened. You see it, you understand it, process it, and put your foot on the brake. Well, that slows down and the older you get. I can say I'll pick on my father alone. Riding with my father gives me anxiety, and I don't have anxiety. Like I've just always like, I'll drive. I don't care if I just drove 72 hours straight, I'm gonna drive. His just reaction time's different. His processing we see is different. Again, my dad's 65, so it's not like he's creeping on the deathbed, but we see these things. Prolonged reaction times are slower. We just talked about that. So the higher instances of falls because of that. Maybe they don't see that step down as you're walking like off a curb. Yeah, that's why they paint them yellow. But if they don't see that in time and they go in that, was that 3, maybe 4 inches at the max gap that they just tripped and fell, that may have caused them to drop to their knee, break a hip, and now that they have that bleeding on the brain that's caused all those pain, all those issues. Now give me 1 second. I have to help my wife real quick. I'm gonna mute y'all just in case. All right, I'm back. I'm back. No, she's not beating me. She's actually making quesadillas, and the quesadilla thing broke. She had to figure it out how to get it open. So again, these prolonged the reaction times and the falls. That's something that I always like to say is you have to be careful. And again, if you notice, you ever go into like a retirement home or assisted living, there's a lot more carpet than there are tile, because it does, even if it's just carpet on top of hard concrete, it helps prevent them from striking the concrete direct and having, that subdural hematoma because of hitting the concrete. There is a little bit of padding there. If it works, it works. I don't really know. We still notice that. Keep an eye on that. You go to some of these places. Just, you may go to visit, but notice that. Their sensories change. Pupillary reactions. Visual distortions are common. Cataracts are common. Hearing loss is 4 times more common than vision loss. Oh boy, my daddy can't hear nothing. Huh? What? I agree. I can't hear, but that's other issues. But my daddy can't hear nothing. So we notice the high frequency loss is gone. They may not hear those higher tones, like ambulances, humming noises, let's say electrical hums. So sometimes when you talk to these patients, you need to look at them in the face and talk louder. It's not out of disrespect, and it's not like you're yelling at this patient, but understanding and speaking to them properly may help things out drastically. That will allow you to maybe communicate better with your patient and to let them know that you understand. And it's very big for elderly patients for you to, let me make sure I understand what you're saying. So repeat back to them what you hear, not what you think you hear, and go with it that way. But because that helps. Bailey makes a very good point. Masks have been a struggle with talking to elderly patients because it muffles. You're correct. It's a challenge. It's a challenge to get to that. I've noticed even hearing my father with a mask, and it's very difficult. So that's something we've all had to learn with, and I'm sure teachers out there trying to teach with these masks on is not been an easy task in itself. So I really don't know how to answer or to give y'all some guidance on that. It's just some of those. And then if you change from just your regular cloth mask to like a KN95 or N95, or a true respirator, you have these difficulties again. It's like, I'm trying to talk to you, but I'm your father. It's the same thing, as y'all know. Bailey, always feel like you're yelling. You're correct. And it's like, I just need you to speak English, but it's not that. It's just these masks are also creating issues and when we're trying to talk to them. Next, let's see. Some of the psychosocial changes. Until about 5 years of death, most people retain high brain functions. And again, I'm gonna resort this back to this year, and due to the COVID, everybody has, I want to say everybody has recessed a little bit. If you, like my grandmother, she literally spent 1 year away from us in her house. She's locked away. She did only go to the grocery store, but she wouldn't let nobody come visit. She wouldn't let do anything. So we see these people have recessed and not had the brain function. So sometimes look at our kids, they homeschooled, they did these Zoom things, and Zoom was new to all of us. And we were like, the hell is Zoom? What do you want me to like Zoom what? Rob says down here at the bottom, sometimes Something else to consider, usually hearing loss is to do with the range and pitch, not necessarily volume. If you lower your voice pitch, they may hear you fine. That's true. I don't know if y'all can hear me, but it sounds better if I talk like this and I'm clear and I lower my voice. Um, again, my father-in-law just can't hear anything. He makes up what he thinks you say. So that's a very good point. I'm glad Rob brought that up. Um, what's it say? Statistics indicate that 9% of the elderly live at home, and I think they should. I mean, you think about that. I mean, as of now, elderly don't, and anytime you go to take care of them, don't they feel like they're a finance? They feel like they're a burden on you and the system as an EMS provider. That's not the case by any means. I would truly like to rather take care of elderly people because it does take me out of the system longer. They do require more attention, but you have to move slower to make them feel more comfortable. So, eh, it all breaks down to it because you're really out of the system that much longer and you don't have to answer 7,000 runs versus seven. Um, so let's see, increased need for assisted living facilities, financial limits may restrict access to healthcare and medications. We see that so much that Social Security has only got them at certain levels. They pay them, some folks only bring home like $300 a month on Social Security that I've seen, versus some are bringing home like 8 grand. I don't know the difference, I have no idea. That's our federal government and the way that they balance that out that I don't even want to know yet. But financial burdens are really big, and these think about these medications, how expensive they are. Like I just got put on my migraine medicine was like $700 once a month. Well, I was like, no, can't do it. I'll just deal with migraine. We had these certain, these companies that give these buy cards and then foundations. Well, a lot of people just don't know and have the ability and time to do it, so they just don't buy it. Some people's blood pressure medicines are, you know, $60, $70 a month. That's just for one. That's not counting all the other medications they take. So they have to make decisions on which one to feel and which one not to feel because of financial issues. You'll notice as you start to recognize it and you move throughout your EMS career that assisted livings and nursing homes are popping up everywhere. Everywhere you look, there's another nursing home, and they always build them out in the middle of nowhere, not near the nursing home. I mean, not near the hospital. So it's like I gotta take Betty 45 miles instead of just 4 miles where the other one's located because they want to be bigger and have them abilities to see more. So it's a money making process. The same thing as daycares. Daycares are popping up everywhere. People having babies left and right. And daycares, these facilities, elderly and geriatrics and infants can name their price because you gotta pay it. You're gonna pay it. So again, think about if these families, the burdens that these elderlies may tend to put on the family if they go to a assisted living versus nursing home, or can mom and dad just really function at home? When is when? Well, that's a hard decision. And then you have these geriatrics that are now, I keep saying geriatrics, that's just what I'm used to saying, so I apologize. So these older adults are getting to this age group. When is it safe to stop letting them drive? When? That's a decision that, and it's a difficult one. We did that with my grandparents before they both passed, and it was like, okay, like we had to sell their car without them knowing, and then we're like, oh look, your car got stole. We'll file a police report, and then they were mad. They didn't know. It's just it was a safety thing for them. They thought that they were still in their normal ability range. And I'm sure my kids and I will have that fight at a later day too. But that's just part of it. Let's see here. I'm gonna say this is about accurate. It says more than 50% of single women in the United States who are 60 years of age or older are living at or below the poverty line. I don't know why they single the women out here, there's a lot more of single women and men nowadays than I think I can recall. And it's a decision change. My grandmother is a single, she's been single, whoo, geez, since I was like 10. And she lives very comfortably. I mean, she's financially set. I think she worked for like maybe only been retired like 8, 9 years, but she was financially smart. So again, but that's the national standard, is that it's set at this level. It's set at 50% of women are living, and the poverty line is growing higher and higher. I think Dateline or something did a story a while back about the poverty line and what men and women are having to do across the nation to function, to make it go, what to make ends meet, how these cutbacks and are affecting the single moms and the single dads. So it's hard. The career changes and the paths and life, factories shutting down since COVID and just not having the ability to open back up. People stores are closing because they don't have people that are willing to go back to work. So it's a hard thing, where we're at and what our life's going to end up as. Elderly need to face their own mortality. That is y'all, this is hard. I think we're all scared of death at some point in time. We know that ultimately that's the end stage of life. How do you prepare for that? How do you prepare a family for that? With my mom passing, we knew it was stage 4 cancer, but we knew that was the end. None of us wanted that. It's a better place and time for her now, but you can't really prepare somebody for that. That's a personal thing. I think as a provider, the best thing you can do is be compassionate, be considerate, and if you're just if you're not saying you make yourself, but if you're just physically attached at that moment and you've been there and maybe you were the one that pronounced granddad that passed away and you can't leave just yet because the police has not gotten there. Maybe if you're emotional to cry with the family, get in there and shed a tear. You're human. Just because we're in EMS doesn't mean that we're supposed to hide our emotions. I, but I'm a grown man, and there's times that I've sat there and I'm like, man, that really got me. Like that affected me. It's easier in life to see elderly people pass versus our younger infants, children, school. I mean, you say at what age is it a good life? Well, I think I'm in my young age right now, but I'm not ready. But we know at some point in time, that's the end stage of life. But preparing people for them to see their own, I don't know how to tell y'all some good passages on that. And right there, isolation and depression can be challenging. Look at these challenges we faced with just COVID. This is the only pandemic of my life that I can ever recall. And I think my dad has said the same thing. But in 40 years, we've never, in my instances, have never kind of pandemic to where the world has shut down. I mean, look at the things current right now in our news. Let's say look at the Olympics. Like they're having to make leaps and bounds changes over there because this is something the world is dealing with. This is not just a US problem. So the isolation, and these people have been living in their homes for so long, and now these elderlies are being exposed to the environment again, is just like resetting this infant to being exposed to these new challengings that are out there. So they're now getting more and more sick because of that. They get these colds out of the blue, and they're like, well, I don't know why are they always sick? Hang on, I'm looking for something real quick so I can. Okay. Didn't find it. All right, so here, let's go click on our review. We'll go over the review for a little bit, and then we're going to answer about 8 or 9 of these. We're going to take a quick break, so I'm going to scarf some food down, and then we'll go back over some other things. When providing bag, mask, and ventilations to an infant, What is the most important thing to remember? This is everybody. Y'all tell me what you think.
B.
All right, so the majority of you are going with B. Let's see. There you go. We talked about that. Just remember, it's like blowing into a balloon. You have the big expandable ones where you can put like stuffed animals in versus the little bitty party balloons. They're some are fragile. Our adult ones are more flexible and reboundish. Number two, you see an infant capable of reaching out to people and drooling. She is most likely how old? Whoop, sorry, I hit the wrong button. C, way to go, Bailey. You're on it. Sorry, everybody else. I apologize. I'm not going to click anywhere on this one. I'll give everybody else a better chance. An infant who is repeatedly rejected experiences what type of attachment?
C.
All right, I'm going to throw a curveball on y'all. The majority of y'all said C, but this one is going to be B. Anxious and aberrant attachment is observed in infants who are repeatedly rejected. In this attachment style, children show little emotional response to their parents or caregivers and treat them as they would strangers. These children develop an isolated lifestyle where they do not have to depend on the support of other carers. So I don't want to pick and say our introverts. No, that's not what I mean. Just because if you're an introvert person, it's cool not to like people because sometimes I don't either. But I get that. But over time, people that seem to have more trust issues are more introverts because they don't have to depend on anybody else and they don't want to be hurt again. So that's why B is chosen on this one. Let's go with the next one. Why do colds develop so easily in toddlers and preschool? Ah, sorry, y'all. I hit the wrong button again. I'm trying to. So D, all of the choices contribute to a toddler or preschool increased likely of contracting a cold. Sorry about that. All right. So the pulse rate of a toddler is what? Now this one's important. So y'all take a second and look at your notes. All right. So there's some back and forth on this one. I see maybe D's and B's in here. But this one's going to be B. A toddler's pulse rate is 90 to 150 beats per minute. Now, 90 is it's still able to sustain life, but understand that is at the very bottom spectrum of what we want them to be breathing at. I mean, pulse rate, I apologize. So 150 is kind of like your max. That's kind of your normal. You want to find that middle line. But it's important, like I said from the beginning, that you guys understand and you start to know where the ranges are and for these different age groups. So, and the reason why is because you potentially going to see these again on registry or on a question that may come up about as we take an exam. I don't know. I haven't seen an exam. I just chose the bank of questions and it randomly picks questions. So I can't tell you what you're going to see, but I know as in seeing these rates, rhythms, there's a reason why we go over them and we preach them so much is because they are very important. And this is the range that they should be in. All right, number 6, a school-age child looking for approval from his peers in society is demonstrating what kind of reasoning? All right, looks like everybody's hit that one on the point. So B, very good job. All right, so the next one, self-concept is what? All right, there's a few that maybe had a different answer, but self-concept is how we perceive others. Well, I mean, we may not need to ask, but if you ask what somebody thinks of you, you need to be ready because it's on you. That's an individual's thoughts. So don't ask me. I'm just kidding. All right, so why should you be concerned about a 16-year-old patient who seems depressed? So why is that? I specifically remember talking about this one.
C.
I don't even have to look. But y'all are right. We know we talked about that. They're more susceptible to depression and suicide. They're at a very higher rate. And sometimes your elderly is hard too. We'll talk about that. I actually know I know an elderly couple that the wife was terminally ill, and she always said that she never wanted to be a burden on anybody, and neither did the husband. And it was at that time they both knew that she was fixing to pass, and it was an agreed statement that they both die together. Well, uh, they agreed. He shot her, and then he shot himself. But in depression affects the ages too, because now they're dependent upon somebody. But in the teenage view, they see these because they go on appearance, clothing, look, sexual appearance, their body shape. It depends on all of that. But out of all of them, go with your teenagers at the highest risk. All right. Why do finances become an issue during middle adulthood? Finances are always important in my book. I mean, that's me when I was young. All right, everybody got that one, which we know. It's you're you've basically gained 2 more children. I don't want to by no means say that I physically support my dad. My dad's very independent. He works 40 plus hours a week still. Um, but again, I helped my dad. We saved some money, put him on my cell phone plan, saved him almost $1,300 a year in cell phone plan. So, and we do that is because that's just part of our job. We want to take care of another. And I remember my parents doing the same thing for their parents. I was like, why do they can still pay for theirs? It's not that they can't pay, but finances become more of a tightened thing as the older they are. I'm still able to go out and work 40 plus hours. I work 2 weeks on, 2 weeks off. My 2 weeks off, I hustle on the side. I do my side cash. But that's everybody. The older you get, you just can't do that. So we want to do better for somebody in the older generation to make things feel a little bit better. All right. And number 10, why is breathing more labored intensive in the elderly folks? And again, looks like all y'all nailed that one on the T. All three of these are factors in major breathing and more labor intensive for elderly. I mean, boom, y'all own that one. Rob, you here with us this evening, or did you bounce out? I didn't see you came back. I found you. Rob was gonna talk to y'all about some stuff real quick. If I can talk enough about him, if he'll unmute and talk to you folks.
I mean, you're probably going to hear Justin in the background too, so I apologize in advance.
Boy, that's some struggles right there, both of them. All right, Rob, I'm gonna mute for
Yeah,
just a
that's
second.
all
But
right.
I'm
He's cooking food. All right.
Oh, come on.
I can cook and treat patients at the same time.
CPR with one hand, make a stew with the other. All right. So before we get into tonight's reviews, because I know you guys are at the last chapter for your module 1, I wanted to talk about what you went over tonight specifically. So we throw a lot of stuff at y'all, and it's going to get worse. I wish I could say that it wouldn't be, but this is the intro chapters. But this one and the one that you just did are kind of a taste of what's to come. But I want you to take tonight and don't look at it as a mastery chapter. Look at it as more of an awareness, because you're going to have a peds chapter at the end. You're going to have geriatrics, OB, all that stuff. And you're really going to get into the details of each one when you get toward the end of the course. What I want y'all to think about tonight is a couple of things that are going to carry you forward through the next module that you have learned them. So for one, vital signs. All right, you guys picked up vital signs for the different age groups. A couple of things I want you to know is that what is considered minimum and maximum really just depends on the book that you read. The numbers that are in those slides, numbers that are in your books, different company textbooks may give you different numbers, but they're all pretty much in the same range. So the numbers that I remember, and they're a little bit easier, they're a little bit more rounded off, I guess. 60 to 100 is the gold standard for a pulse. No matter what textbook you read, that's what they're going to give you. When you start dealing with kids and infants and the body is getting smaller, those numbers are going to climb. Think of it like a hummingbird versus an elephant. So if an adult is 60 to 100, when you take somebody, maybe the size of my son, who's 11 years old, you're looking at a pulse range that's going to be higher. So 80 to 120. Right. All right. So 20 points higher on average. When you get down to the infant range, 100 to 150, there's a fudge factor. The tests, the registry, they're not going to give you a number that is right on the border. And they do that because there's disagreements on what those borders are. If the registry or the test wants you to know that somebody is bradycardic, which means their heart rate is slow, they're going to give you a number that is definitely bradycardic. So 40, for example. Your breathing kind of goes the same way. The smaller you are, the faster you breathe. The only number that's really different is going to be your blood pressure. Blood pressure is tied to weight. So it starts off small, and as your weight goes up, so does your blood pressure. If you think about it, think about people that are adults. Most of the people with hypertension aren't necessarily elderly. They're overweight. Their weight gets high, their blood pressure goes up with it. That one runs backwards from all the others. But just keep that in mind. All right, 12 to 20 is the standard, pretty much gold standard for breathing. That one's not going to change. For children, I usually go with 15 to 30. So you'll pick like 15 and then double it. And for infants, I do 25 to 50. Pick 25, double it, that's your range. Those are pretty standard. Again, they're close enough and they're just easy to remember. If you're looking at a number like 90 to 150 or something, there's really no easy way to remember that. But if you could say 100 to 150, you're close enough that you'll still get those questions. You'll catch those questions on the registry. The other thing that I want you guys to remember from this chapter is what the priorities are for the different age groups. So when you're a child, like an infant, you're really only concerned about your sustenance. When you're hungry, you cry. When your diaper's dirty and you're uncomfortable, you cry. When you have to go to the bathroom, you typically cry. You start going up in age, you start to really mold your views of what you need based on what's around you. By the time you get to be a teenager, you're really more concerned about your image. We've had people that have had accidents we've responded to where the girl in the driver's seat is dying, and she's only concerned about how her face is going to look and if she's going to have any lasting damage to it, just because that's where she's at. your priorities change. When you get to be an adult, middle adult, you're really more concerned about things like stability, right? So your finances, those kind of become your priorities. You're really not too concerned about the scars you get and stuff like that, because who really cares? Like your priorities change. When you get to be older, you really start to be concerned about your independence. That becomes a priority for the elderly. I'm pretty sure that was mentioned in the class, but just keep that in mind when you're dealing with an elderly patient. You want to try to, even if you think that what's going on might actually affect their ability to live on their own or something of that sort, you really don't want to let that show on your face, because it's going to shut your patient down and you're going to have problems. So knowing where your patient's mindsets are based on their age groups is kind of the drive of this chapter. I don't want you to be masters of geriatrics or pediatrics yet. We'll get to that. But just kind of get the overview. This chapter and the anatomy chapter are more of an awareness. As we go through the course, you're going to kind of hit and really get the details of what each individual thing, kind of how it pertains to your patient treatment and your patient care as we go. Other than that, that's really pretty much it for this chapter. It is short. I like it because it's like a case study in psychology. You really start to learn about how different people think, and the approach you take with an 8-year-old is not going to work on an 18-year-old. Right? How I have to treat my son and my daughter are two very different things. How you treat a 60-year-old is going to be very different than how you treat a 40-year-old, and vice versa. But from here on, Chris, you can unmute. I'm going to kind of bow back out, but the rest of the night is y'all's to review what you feel like you need. With the module exam coming up, don't be afraid to ask questions, because I guarantee you're not the only one that doesn't know that. All right. And we're both here. And actually, Justin's here too. So if you guys don't understand an answer from one instructor, you've got 3 of us sitting around that can help try to explain things. Other than that, y'all have at it.
All right. So thanks, Rob. Appreciate it. Justin, appreciate you whipping up some soup in the background. Vast full of knowledge right there. You got 2 good dudes on the other end. So man, they're ready to help. Yes, I do have everything for the night. But this is the last. I want you guys to let us know, and gals, sorry, what you want to hear. What do you want to focus on? Do you want us to go over something, retouch? Do you need us to go back over a certain chapter? You can ask specifically if you want to go, back over, medical abbreviations. Please don't expect me to do that. I'm gonna pass it on to Rob and them, because y'all know I struggle through that. But let's talk about anything. If y'all wanted to, we'll do this for every chapter that we come to. It may be to where we can fit it in, and we say, hey, look, we got 30 minutes to go over it, but what do y'all want to go over? But tonight, guys, we got plenty of time. So y'all tell me what you want to talk about. If there's anything for anybody, if y'all don't want to do it in an open group session, shoot me a message on Discord, and we can try to figure out some time to get back into this class, and I'll lock it so it'll just be the 2 of us. Colby says, if you don't mind me asking, how many questions are on the module? I think I set it for 50 questions because we're covering multiple chapters. It is I don't know how many questions I asked from each module, so I can't answer that. They're all different for every single person, if that makes sense. So you may see 7 from this chapter and 43 from the other ones. I may potentially need some help with questions. Just don't have any questions I wrote down in front of me right now. That's cool. Please shoot us a message. Again, we do have multiple chat groups if you don't want to do it here. We have multiple, like, what is it, Rob? General questions or something like that in our Discord. Or
Yeah, so
we
guys,
can,
general chat's usually the easiest way to do it if you want to put it in there. I would say this. You don't have to mention it out loud here if you don't want to, if you're shy or whatever, I get it. But if you don't mind, try to keep it in a public forum, because like I said, you are not the only one that has these questions. Chapter 6 is hard for everybody. Chapter 7 can be hard for everybody. So, keep it, if you're going to put it in a Discord, just put it in, not necessarily in the community chat, but in was it EMT general chat or whatever, for your class. That's the easiest way to do it that way, because the other person may not have wanted to say anything, but they had the same question.
And medical terminology was really hard for your instructor. So I will ask about that, I promise you.
But if anything comes back to mind, we can go over physiology. Absolutely.
I came in a few minutes late tonight. Is the module exam open? That is correct, Rebecca. It is. It is open for 3 days also.
How many times can we take, or it's just a one test only? Like we just take it one time, or we can attempt twice or something?
Stand by 1 second. I'm trying to type to another student on a direct message. So I'm not ignoring you, but give me a second. Multitasking is limited in my range.
I'll answer it while you're texting.
Okay,
all right.
cool.
So tech issues will always not count against you. If something happens and you have a tech issue, you can always retake it. If it's 5 different times, but at that point, we got to figure out what's going on. You do get a second attempt if you fail the first time. So have that security, but don't lean on it. All right. I don't want you guys, because there's a retake policy on how you go about retaking those tests. And if you lean on that, you're going to run out of time. You're going to find that you don't have the time to do that and keep up with the class. But yes, you can retake if you need to.
So I want to, as hopefully some of y'all are messaging me on the side, and I'm sorry, I'm trying to make sure I answer you correctly and I hear your question. Thank you, Rob, for jumping in on that. I really want to just double tap on you guys. Please, please, please make sure you're submitting your attendance also. I know we've not had any issues, but I still want to keep on that. I don't want y'all to get busy and forget. I say this again, and I'm not trying to tell anybody, I'm here for a while. Good luck on your module attempt. Please take your time. Don't rush through this. This is not, it is timed. National Registry is timed. That is the reason why you get a time limit on certain things. And I feel that we've given you a pretty good lenient on time. I think, Rob, correct me if I'm wrong, registries, max out at 3 hours, or you get a 2-hour time limit on the written part. That was
It's
probably
2
the
hours.
longest test I can remember ever taking. 2 hours.
Yeah.
It
2
is
hours for
computer-based,
base.
So it is that's the reason why we want to time you guys. I think that's very important.
Yeah, because you could wind up with 120 questions in that 2 hour time span. That's a question a minute if you're riding that line.
Yes. So so again, read the questions for what they are. Don't overthink them, and you're gonna look in them. You're going to overthink them when you get to the registry setting, because if you know so much now. But read the question for what it states, not for what you think it says. If there's the question banks are very, very good for these chapters. That's the reason why we've gone with Navigate. They're pretty jammed. They have a registry-like base, so you're getting exposure, if that makes sense. So we want you guys the best opportunities, and y'all are showing out that y'all are doing well on these, and I'm here for y'all. I'm not just Rob, and we have other access. We have other instructors that are here. So please, in Discord, you can use the @ symbol and type our name, and it sends us direct. If you're in a group chat, if you're like, hey, @Chris Wally, or @Rob, so so you can alert us that way. We're here for you guys. We're awesome. Let me catch back up, Rebecca. Give me a second.
While he's looking up that slide that you're asking for, the biggest things that I want you guys to know about the fontanelles, just from my own personal opinion and what we see with the registry, is that they need to be flat. They need to be flush with the skull. If they're not, that's a problem, right? So when Chris was on that slide, he was talking about whether they were depressed or inflamed out. If they're depressed, I want you to immediately think dehydration. If a child is either A, they're not being fed properly or getting their milk like they should, or in the case of actually myself and a bunch of other babies out there, they may have an issue where they can't digest the food that they're drinking. So either way, they're not getting that fluid. And when they start to dehydrate, their fontanelles will sink in. So that's one of the things you're going to see when you rub your hand over their skull lightly. You're going to feel, if you don't feel a depression or anything, if it's all flat and round, then fantastic. If you feel it depressed, that's dehydration. If you feel it inflamed or like bulging out, that's a major problem. That can be TBI, traumatic brain injury. It could be something medical like, oh God, now I'm drawing a blank. Could be a birth canal issue.
I
It
know
could
it's that
be,
sometimers, bro.
do what?
That sometimers kicking in. They're picking on me about.
God, man, I don't know. It's been hitting me a lot lately. The senior moments come more and more often, but it'll come to me right about the time that I mute it. I'll unmute and say the name of the illness, but it's something that you typically don't see in infants, but you can. And it causes that inflammation in the brain cavity, and you'll see the fontanelle swell. And if that happens, it's get them to the hospital as quick as you can. But yeah, we want them to be flat. So that's what you're checking for there. It's not so much about how the diameter is or the distance, that's something for the hospital to figure out. We just want to know if they're flat, depressed, or engorged.
Rebecca, is this the one that you're referring to, or just want to make sure? And I know there's another question.
Meningitis. That's what I was looking for. I told you as soon as I mute it, I'll get it.
I think it's the one before that. The one that was yes, that one.
Okay. And folks, I mean, like I said, don't feel like I've had several hit me on the side about some questions. Please feel free. Y'all are more than welcome to hit me on the side. Not something we have to discuss out in group. I may, depending on the question, if it's a really good one, I may read it out loud. I won't call y'all out, I promise you. So we can discuss that again if somebody has a question further about something.
Chris,
Yes.
something that's helping me a lot is being able to read these PowerPoints. Will you be posting the chapter 7 PowerPoints on there? Because they're not there.
Yeah, I don't know why. Yeah, I was told that earlier. I think it was Miss Rebecca that told me that, and I don't know. I'm gonna go back in to navigate when I'm finished with you guys and to go over that. I know that the audiobook is there. I know that may not help you, or you may hear the monotone voice, but I will see why, and I will double check into why that is not. It's not why it's not there. It may be something that has been clicked on or clicked off of. I don't know, but I will find out. So y'all give me 30 minutes after we get situated, and I will dive off into that and see what's up.
Okay, thank you.
I don't know if something happened like between Sunday night or Sunday day and Monday night, because I noticed that they were there last night, but they weren't there on Sunday.
Well, so I'm trying to figure out how to answer that. So there has again been to navigate concerns. Rob and I have been on the phone a lot. I don't want to say a lot. We're trying to make things better, smoother for the process. And so there has been some conversations with navigating. We think we've narrowed it down to what the situation is. We are currently working on that, and that may have been the call. I don't know, but like I said, I will go click through the instructor side of it and see if something has changed or something's been edited differently.
Yeah, I just didn't know like if that would help like narrow things down as, you know, something being the cause for them being
Yeah,
there
I
one
will.
day and not the next.
Well, bear with us. Bear with
promise
us on
you folks.
Navigate. We're having some issues with Navigate that are they're really not anybody's fault. There's been some transitions that have popped up, and y'all might see some of the repercussions or the ripple effect of that. Just be patient with us. We are working on it. So if something is there 1 minute and disappears the next, we will get it back. It's just give it a couple days and everything will smooth back out. But let us know if something's missing, because we may not realize it's gone. So let us know and we'll get it. We'll work to get it back on there as quick as we can.
Is there any other questions? Like I said, folks, this is your time. I mean, we're here. I know y'all are gonna get tired of me. You won't always have Rob around or Justin's vast of knowledge. So if you have some information or questions, please ask. I mean, I promise you, I don't know it all. I'm tapping some cool dudes that are on the other end over there that can help out. All right, folks. Sounds like a lot of you are gonna handle it on your own. Here's your code for the night. Again, please make sure you're submitting all your attendance. Let's make sure you do that before you take any test. Your class code for tonight is 24369. I'm gonna type that in the chat so everybody sees that also. But again, the class code is 24369. 24369. That is in the code. Please, 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 please message me, ask me, shoot me a message, email, Discord. Let's help everybody out. Good luck. Deep breaths, take your time. Don't rush through it. I'm gonna hang out here in the background for a few more minutes. If anybody has any questions, concerns, or problems, it can just be narrowed down to us. But we'll work through this. Good luck to you guys. Thank y'all so much. I'm gonna hide out here in the background unless y'all need something.
I like that last slide, Chris. Thanks for putting that in there, man. That's a good way of doing it.
Oh, I do it every class now. It's so much easier for everybody.
Yeah, because I was hoping that Zoom would be different than GoToMeeting, but I noticed that the chat still does not show up in the recordings. It comes to me as a separate, like it's an entirely separate file. It keeps it, but I have no way of putting it in the recordings.
Yeah, I was gonna say, I know that it gives me several different options like Dropbox, Google Drive, Microsoft, and stays on my computer.
All right, Chris, appreciate the class tonight. I'm out. We'll see y'all later.
Appreciate it, dude. Good luck on your test, bro.
Thanks, man. Probably gonna need it.
You'll be fine. If y'all need anything, just let us know. All right, Chris, I'm going to bounce out. If you need me, call, text, or Discord.
Yeah. Roger that, bro. Y'all be safe. Have a good time.
You too, brother. Enjoy your time home.
Yes, sir. See y'all later.